Sayako Hatano, welcome to the Tokyo Living Podcast.
Thank you so much for having me, Tim.
So you are a occupational therapist, and we are looking forward to delving into what an OT does and what sort of work you're doing in the Tokyo community. Perhaps if you can start just by giving the listeners and viewers a little bit of background on yourself.
Okay, so my background is I was born in Japan and grew up in Japan and obtained a certificate as an occupational therapist in Japan.
Okay.
My journey as an occupational therapist was not in the field of the pediatric occupational therapist, but in recovery and acute the
Okay.
rehabilitation, and most of the which were ordinary.
Yeah.
Then after that, so I moved to a company that provides the visiting service, home visiting service.
Yeah.
And that's when my new career as a pediatric occupational therapist began.
Yeah.
Yeah.
So I guess for people that I guess more people would know what a physiotherapist does through previous experience and perhaps being in contact with physiotherapists, but perhaps not as many listeners would actually know what an occupational therapist does. So what are sort of the main roles of an occupational therapist, and what's sort of like a basic outline of the profession?
Yeah, it's it's a kind of very, very difficult to explain everything, but occupation has the overall the focus on the covers a wide range of the area to the develop the life skills.
Yep.
Then the main object of the occupational therapy is the able to the people to do all the things the people do in the everyday life.
Yeah.
Then I think that's our aim is to assist them to the cope with the demands, adapt to the tasks, and overcome challenges to be the sort of independent and engaged with their peer and the environment.
Sure. Sure.
Yeah. Then, yes.
And I guess so. From my experience, I haven't worked a lot in hospitals. Most of my physiotherapy experience has been in private practice. When I was doing hospital work, 20 years ago, a lot of the occupational therapy that I was sort of working with was actually less about working on a person's like capacity to handle their environments, but actually changing more of the environment. So let's say I had a client who was discharged maybe after a stroke. The physiotherapist would get them up to a certain level of physical capacity, and then the occupational therapist would look at what the demands of their life required and try to adjust that. So that might mean modifications for their home environment, changing, installing ramps, installing rails, all that sort of stuff. How much of it, I guess that's probably a different end of the spectrum, and probably more with geriatric occupational therapy. I'm imagining more of your job is actually changing the capacity of the individual to handle their lifestyle demands. Would that be a sort of fair summary?
My client is having this developmental issues, and probably can provide competitive service that I providing.
Yeah.
I mean, the children who may the kind of the difficulties in the development and physically, mentally, of course, having us that just cannot do that. I think that all over the areas, the development that we are, providing. So that it's very, very difficult to just say that it's just one word, but yeah, it's just that very, very sort of or is it comprehensive service, comprehensive service.
Comprehensive, yes.
Yes.
You're trying to optimize all areas of the care. Yeah.
Yes.
So, what then got you involved with pediatric occupational therapy? Was that something that you had wanted to do for a while, or what sort of prompted that change in direction?
There's just many cases, so I can't say it easily, but every children is born with the something power to grow up on their own,
Mm,
then their own world, little by little, so the children create themselves by expecting the world and repeating new discoveries and the challenges.
mm,
However, the children who have some difficulty developing and or the learning often have the unevenness in the basis of the development. So
mm.
that this often leads to the loss of the opportunity to the repeat new discoveries and also challenges. So
Yeah.
that yeah, then in order to the approach the so do yeah basis of the um um and even the development that has become the stumbling block
Yep.
and to develop the children's abilities at a steady stacking is necessary and the progress is often difficult to see and the measures.
Mm,
Therefore, those who seek imitate as a result of the ignore to build up of their inner development,
mm,
core development by the demanding the specific improvement. Then, however, once they are able to adapt to the tasks and realize that
mm,
they have overcome their challenges, they they can begin to live their lives in their own way by
mm,
building up the more experience.
mm,
So I think that what we can do is let the children um, who are living in the parents living in the present with all their might experience the challenges that face and the things that don't go their way.
mm. So, what are the common problems or some of the common difficulties or specific conditions that
Mhm.
that you treat within your practice?
There is so many cases there. So that, for example, the Down syndrome, of course, developmental issues.
And is it so do people come to you with I guess what are the sort of typical ages that people do you take a lot of children from very young, say sort of one
Mhm.
years old, or do you take people up in like towards sort of the end of the first decade, so 8 or 9 years age? What are the sort of the common ages that you work with the children from? And I guess do you find that there's like a window where you're able to make the biggest impact on a child's development?
Yeah, so my client is it's their newborn to there's almost the 18th or something like
Oh
that.
well. Mm,
Yeah, so then the age range is very wide. Then my most story is that my client is just 3 to 7, 8 or something like that. It's just the
mm,
most for like that ages. But I'm expecting to have a session with a more older ages because yeah, but it's a very so that the many people that very difficult to have also the seeing the professional people if they even if they are having something that concern to their baby's development or um, worried or something like that, then um, so then it's a different reason. It's a very need to find out something that's kind of the concern that if the parents have the sort of more early ages, then starting the approach to them is a very benefit they have. So I I'm expecting to have also that, seeing the more early ages people, then as I'm just trying to providing us a service as a sort of for the parents and the babies now.
Yeah, yeah. So I was actually going to say that. I mean, you incorporate the parents into the treatment and into the training as well. And you obviously, if someone is a 1-year-old, you really have to, it's doing a lot with the parents. But I guess for all juvenile patients, you're including the parents in the part of the treatment process.
The process is so that really so that I think it's the same as the PTs. Then we have the medical evidence based or observation, and also the assessment also. Then we are so that we are manage the session, the program. Then of course that we have to explain to the parents what's the cause of the things that made this concern or the worry, the kind of the difficulties for the babies or the children. So then we are starting a sessions with them. Then also that we have to evaluate their not only the functional things. Then we observe the children, so not only the developmental disabilities, also the functional interventions in the children's home, the schools, the kindergarten, and or the child care facilities. And to help them reflect what they have learned with them, us, and in their daily lives. It also works with the family and the educators and integrated as assistants to the providers of consistent support, the monitoring and the assessment of the clinical programs.
Obviously, so if someone had, let's say, a child that was born with Down syndrome, that type of things obviously identified very early. Perhaps more serious developmental delay would be identified early. Obviously, if someone is, significantly premature in terms of their birth, those are all things that are going to be picked up and probably managed early on. What are some things, maybe, I guess, more subtle things that not affecting a child's development in a major way, but some things that people might not be aware that occupational therapy can help with? Like, for example, if they have a child who's maybe 4 or 5 years old and they notice that they're not moving quite as well, like if they're playing sports, they're not quite as well coordinated, things like that. Are there some instances where things aren't, you have this specific condition and therefore you need occupational therapy, things that are a little more subtle that people may not think of occupational therapy as being an option?
It's not maybe so that if the children is doing the to work or something like that, we have also assessment, and not only the physical or functional things, then also that we have the probably same as the pediatric PTs. Then we also have also assessment with also the neuro assessment things. And also primitive reflex things or something like that. Then we are try to find the cause of the why these things happen. Then approach it to the difficulties. So of course that even if we are saying that kids are doing the toe walking, but the cause of the toe walking is totally different. Just the functional things or functional things. physical functional things, or so this is over from the neural things, or totally completely different. So that it's very important to find the why these things happen. That we should find the cause first differently. So then, yes, so yeah, it's also the very, very important things. Then if we are find out the causes, then kind of with us our approaching the halfway, getting it at the halfway, then make us the program to the what kind of the program that kids are enjoying. Is that it's kind of very important that that maybe adults can do that, maybe kind of the hard work, hard exercise things, hard workout things that are easy, because so they can understand why so that we have to do it. So it's very easy. But the children cannot understand why we maybe it's 5 or 6 years old, it's possible, but most of the kids cannot keep to do it. It's something boring, the programs every day. Yeah. Yeah. So it's also very important to build, make us the program as the playing.
Yes.
I mean, yes, it's also the key to do, to make a program to the kids.
Yeah.
So yeah, then of course I guess I think that of course the parents have to understanding of the causes and try to make us their kind of the habit, keeping also not to fix their issues, not only the focusing the fix the issues, then just try to build also their own habit, the keeping of their health is also kind of so very, very important to the sort of approaching the kids. I think.
Yeah. That's great. So at the moment you're seeing, do you see the clients that you work with out of a clinic, or do you go to their homes, or do they come to see you? How does your practice actually, logistically work?
I'm visiting the client home, then also visiting the school, international school in the Tokyo.
Yeah.
Several international school. Then yes, I'm doing, and so also I'm starting having a session in the gym also.
Okay, cool. And are there any other sort of projects that you're working on at the moment? Are you any sort of future endeavors?
Already I think that I told that, but the people under the ages of their maybe 3 years or 4 years old, then you're very difficult to see that the professionals, even if the parents are having something concerned also for their development, and it's always there's a suffering. It's just that there is a serious concern, the worries, or something like that. Then maybe. But still, the 3 years old the people is a very, very that their growth is very fast.
Yeah.
Then also that the parents that starting the seeing the kind of the difference between their kids and the other kids, and having a very, very concerned is that, and so also the things nervous about it.
Yeah.
So but still there's the the problem is that in the pace of the children development, there are too few ways to solve the problem in the child case, such as asking someone, and there are many parents and the children who cannot get in solutions.
Yeah.
Then and same things is happen to the families and who are staying in Japan, and so don't non-speakers of Japanese families, so their mother, I think, non-speakers of Japanese families. So that therefore, I'm planning to hold the classes for the baby classes or the preschools, so that becoming, they can connect to me that more easily across to the become occupational therapist. Then that there's the parents and the children, so the cross to the parents and the children.
No, very cool. Yeah. So if people are listening and want to find out a bit more about you, I guess, first of all, I mean, we do have, quite a few international school parents that listen to this. What schools do you actually work with at the moment?
I'm working at the British school and Tokyo International School and some kindergartens.
Very cool.
Yeah.
And then do you have a website? Are you active on social media? Where can people find out a little bit more about you? And if people want to actually perhaps book an appointment, how would they get in contact with you?
Yes, and so you can access it from the homepages and there's a Facebook and there's an Instagram I have. And you can also send to a direct mail to the Sayako at the kidsprout.therapy.tokyo.org.
Kidsprout.therapy.tokyo.org.
Tokyo.org.
Sorry, Kidsprout.tokyo.
Therapy.tokyo.org.
Okay.
Yeah, it's just very complicated.
I've already messed that up. Let's put it in the show notes and we'll make sure everyone has access to that. So Sayako, thank you very much for coming on the show today. It was great to hear about your practice. As we talked about off air, it's always great for us, being in a physio environment, to have an occupational therapist to connect with, because I think that there's a lot of our clients, pediatric clients, that would benefit from it, and I think that it'd be a good synergy. So yes, thank you very much for coming on, and looking forward to collaborating and working together in the future.
Yes, I'm looking forward to see you soon.
Yes. All right. Yes. Thank you very much. Have a great rest of the week. Bye.
Thank you so much.